In this video we are going to talk about, is healthcare good in the US? So before starting, please like this video and subscribe to this channel for our future updates. The United States lacks a consistent healthcare system and does not provide universal coverage. Health disparities in health services are the United States' health disadvantage compared to other high-income countries. Although the United States is known for its leadership in biomedical research and cutting-edge medical technology, its medical system has significant flaws, including preventable medical errors, low amenable mortality rates, and a lack of treatment transparency. Another issue that Americans face is the difficulty in obtaining a qualified physician. High healthcare expenditures and a lack of insurance coverage for low and middle-income households have resulted in social and economic discrimination in healthcare. Americans are unable to receive the optimal quality of medical care they require due to a shortage of nurses, physicians, and specialists in hospitals and health centers, among other rising challenges in public health care. In comparison to many other countries, the United States does not provide universal health care coverage. 50 million Americans, or 16% of the population, are without health insurance. Medical costs, such as pharmaceuticals and medical supplies, have become increasingly out of reach for low-income people. As a result, paying medical bills and other medical expenses has become a significant out-of-pocket cost. Deprived communities continue to lack access to primary healthcare, relying on emergency rooms to treat chronic diseases and provide preventive care. The biggest problems with the U.S. healthcare system: high costs of care. In almost every vertical, U.S. healthcare underperforms. The biggest barrier to getting healthcare services in the United States is the high cost. Low-income Americans are disproportionately affected, as visiting a doctor when sick, getting a recommended test, or receiving follow-up care has become unaffordable. These patients have admitted to having trouble paying medical bills and other expenses. The cost of modern technologies and prescription pharmaceuticals has skyrocketed, according to healthcare experts in the United States. Demand for more intensive, pricey services is fueled by the availability of more expensive, cutting-edge medical technologies and prescription medications, even if they are not always cost-effective. Medical costs have risen as a result of the development in chronic disorders, such as obesity. Chronic illnesses account for a large share of healthcare costs nationwide, particularly during end-of-life care. Patients with chronic illnesses, for example, account for 32% of overall Medicare spending, with a large portion of that going toward physician and hospital expenses associated with multiple hospitalizations. The United States has a greater rate of chronic illness and a lower overall life expectancy than other high-income countries, according to the National Academy of Sciences. As a result, medical professionals are focusing more on preventative care to enhance health and lower the financial costs of chronic disease. High administrative costs are a major element in the skyrocketing prices of healthcare in the United States. Some of the government's administrative needs are outsourced to private companies. The goal is to increase administrative efficiency while providing citizens with high-quality healthcare. Lack of insurance coverage. Although the majority of Americans have health insurance, costs are rising and the quality of policies is deteriorating. Furthermore, typical annual premiums for family coverage have risen faster than inflation and wage growth. The lack of health insurance coverage has serious economic effects in the United States. According to the Center for American Progress, the cost of not having health insurance in the United States is between $124 billion and $248 billion each year. Furthermore, uninsured people have shorter lifespans and lose output as a result of their poor health. Health insurance coverage is inequitable. Minorities and low-income households are largely uninsured. As a result, they are more likely to suffer from health problems than insured Americans. Furthermore, because of the high expenditures of medical care, the uninsured may forego regular health examinations. As a result, individuals are more inclined to seek out preventive health care. According to the U.S. Census Bureau, around 27.5 million lower-income workers in the United States do not have health insurance. Lack of health insurance is linked to a higher mortality rate, with estimates ranging from 30,000 to 90,000 fatalities each year. One of the main issues voiced by proponents of healthcare reforms and policymakers is the number of people without health insurance coverage in the United States. Lack of transparency. The healthcare system in the United States is rife with fraud and cover-ups. Upcoding between providers and insurance providers, for example, is a big issue. Providers upcode a procedure in order to obtain more money from insurance companies, while insurance companies charge employers greater premiums. As a result, health consumers find themselves trapped in the middle, with no control over health outcomes or pricing. Difficulty in finding physicians and specialists. Health consumers cannot simply locate a good doctor due to a lack of readily available doctor credentials and accomplishments. Instead, they rely on uneducated online evaluations to help them evaluate characteristics such as staff friendliness and wait times. However, these platforms do not assess a physician's ability to assist patients with their health problems. According to a new AAMC research, there will be a shortage of up to 139,000 physicians by 2033. More physicians are reaching retirement age, according to the survey. Within the next decade, more than 2 out of every 5 active physicians will be 65 or older. The health system is affected by each doctor's retirement plans. Burnout among professionals is becoming a significant concern. The lack of medical specialists has had an impact on America's healthcare workforce, resulting in a variety of issues ranging from limited patient access to poorer outcomes. Over the last 2 decades, the growing shortage of physicians and medical experts has proved that the medical system requires more physicians to provide safe and high-quality healthcare to the public. Unfortunately, despite many healthcare executives and academics' continued attempts to develop long-term remedies, no answer appears to be in sight. Health system need to be empowered. Large-scale changes are in the works. Payers of healthcare, for example, are increasingly incorporating social determinants of health concepts into how they compensate for healthcare services and provide incentives to healthcare providers. The Affordable Care Act, ACA, has had a significant impact on the healthcare system in the United States. The Affordable Care Act's provisions are designed to increase access to healthcare coverage, improve consumer protections, emphasize prevention and wellness, and promote evidence-based treatment and administrative efficiency in an effort to contain rising healthcare costs. One of the most important provisions of the ACA was the creation of health insurance marketplace exchanges, where people who are eligible for Medicaid or Medicare can shop for health insurance. Individuals with incomes between 100% and 400% of the federal poverty level would also be eligible for advanced able premium tax credits, which would help subsidize insurance costs. Low-income communities will have access to a national health service. The medical services are provided by government-paid physicians in publicly owned and operated hospitals and clinics that are financed through tax payments. Furthermore, private doctors are bound by strict regulations in their medical practice, and they are paid by the government. A multi-payer healthcare system offers comprehensive coverage through sickness funds, which pay physicians and hospitals the same rate. This health insurance coverage eliminates the problem of paying medical bills and the higher costs associated with being uninsured, especially when it comes to emergency services. Developing consensus protocols to streamline medicine delivery and reduce variability in healthcare can improve quality and reduce costs. To address the problem, however, more research on preventing medical errors is required. Using technology and innovation, locate a qualified doctor who can properly treat the condition. Some websites claim to assist in finding the best doctor, but they lack the necessary updates to keep up with constant changes. Users will be able to instantly locate health specialists based on their location and health status, all inside one interface, thanks to new technology. People will be able to connect with different physicians and specialists all around the world using online approaches and diverse resources. The Affordable Care Act empowers states to bargain for lower prescription drug prices and bulk purchases of prescription pharmaceuticals, durable medical equipment, and supplies. This will assist to reduce costs, and private insurers will be able to continue to join into private provider agreements. As a result, improving healthcare quality can be seen from both a global and micro perspective. It entails gathering information and assessing patient results, as well as focusing on patient engagement and cooperating with other groups to promote healthcare access. What do you think about our video? Please let us know in the comments area below. If you enjoyed this video and would want to hear from me again, please subscribe and turn on the notification before leaving. Thank you for watching us.